8 best and worst exercises for asthma. Working out with asthma. Love to work out. If you are one of the roughly 20 million Americans with asthma, this may not be a problem. But for some people, exercise can trigger shortness of breath or other symptoms. Fortunately, having asthma, even exercise-induced asthma, doesn't have to keep you out of the game. In fact, as many as 1 is 12 Olympic athletes can take asthma medication. The trick is to make sure asthma is well controlled with medication and to choose your activity carefully. Some are good choices, others may be more of a challenge. Walking, best one. Recently, studies found that adults who walked 3 times a week for 12 weeks actually improved asthma control and fitness level without provoking an attack. They need half an hour at a time with 5 minutes of warm-up and 5 minutes of cool-down. A moderate to brisk walk is the best way to describe this level of activity, says study author Lisa M., PhD Associate Professor of Cell Developmental and Integrative Biology, University of Alabama at Birmingham. Warming up is really important because it will help your tolerance, says Leanne Mark, MD, an internal medicine physician at Scott and White Healthcare in Round Rock, Texas. Yoga, best. Yoga is great for people with asthma. The magic ingredient. I think it's breath control, says Robert Garham, MD, an internist and integrative medicine specialist at Lenox Hill Hospital in New York City. Breathing exercise can activate more areas of the lungs. One of the study found that people who participated Hatha Yoga 2.5 hours a week for 10 weeks were able to cut down on their asthma medication. The same benefit will probably result from Tai Chi, a martial art that also emphasizes breathing, says Dr. Graham. Baseball, best. As a general rule, any activity where your heart rate and breathing rate is sustained for at least 5 to 6 minutes continuously is more likely to trigger asthma than stop and start activities, says Mark Holberic, MD, an Indian policies-based allergist. That makes baseball with its spurts of running alternating with plenty of downtime one of the safer sports for people with asthma. Even so, asthmatics should make sure they are prepared with appropriate medication. One study found that 75% of children who played baseball or soccer didn't have a rescue inhaler handy. Biking, best and worst. Biking at a leisurely pace isn't likely to exacerbate your asthma, but ramp it up to 18 miles per hour and you could be in trouble, says Dr. Holberg. The rapid in and out breathing necessary to keep up this pace can dry out airways, potentially triggering an asthma attack. Mountain biking could be a problem as well. Negotiating steep hills and curves is likely to require heavy breathing, just the thing a person with asthma wants to avoid, but it's not possible to do. One study found that cyclists and mountain bikers were more likely to have asthma than other summer Olympians, yet they were still able to compete. Golfing, best. A round of golf is not only good for the mind, it is not likely to induce an asthma attack. Again, an activity is triggered, alternating swings with walking onto the next tee, but given that golf is played outside, you might want to take into account the pollen factors before you hit the links. If you have an allergic component to asthma and if pollen counts are high, you may want to stay in. Just make sure you are being treated adequately, says Dr. Holbrook. Swimming, best. The ideal sport for asthmatic is swimming because you are breathing in air that is highly humidified and often warm, says Dr. Holbrook, and studying in that horizontal position may actually loosen mucus accumulated in the bottom of your lungs. But be careful of pools with excessive chlorine as the chemical can trigger an asthma attack. How do you know if it's the